going to try to, there's a lot of questions, so I'm going to address some of them pretty, hopefully quickly. It's hard to get through all the questions, as you know. Honestly, if, some of these questions are pretty detailed, and my recommendation is make an appointment. That's what we're here for. And you can get the questions answered, but actually, if I don't see you face to face, I'm just answering one question. Could diabetes epidemic be because of Lyme disease? Unlikely, it's because of the food you eat, okay? And I'll just kind of go quickly. I would say that, and this was a question about multiple sclerosis, Parkinson's disease, polyneuropathies or nerve conditions. My feeling is get tested for Lyme or check for Lyme, or do you have other symptoms that could be significant for Lyme? It's kind of weird, right? I mean, it's kind of weird that you're otherwise healthy and then all of a sudden you get rheumatoid arthritis at 33 years old. And yeah, they put you on Plaquenil and you get better. Plaquenil is an anti-malarial drug. Yes, it is an anti-inflammatory drug, but it's kind of unusual. So I would just say, we are open-minded. And yes, those symptoms of vision loss, of balance problems, those are all the neuropathic symptoms that could be associated with Lyme. I would absolutely say, get tested. And check it out. Can I order the test in New York? Yes, I can order that test in New York. You can be a New York State resident. I have to order it through my Vermont license. You would have to be a patient. I mean, that's basically how it is. Why do early antibiotic treatments work for Lyme? Well, the reason why is because if you get it early, it grows earlier in its earlier forms of infection than it does later, because what it does is just like how resistant forms, it learns about your body. And it doesn't yet know how to hide when it first infects you. So that's why if you get treated right away, typically 4 to 6 weeks of treatment can eradicate. It is really long-term missing of treatment that causes a lot of the problems. If CDC positive on Western blot, if it's not CDC positive, unfortunately the CDC positive criteria is really unfortunate because the CDC has really limited, just like Jennifer said, with the band count. Right? They only allow 3 bands. Well, unfortunately, the bug has a lot more bands. And like I said about band 41, it's kind of ridiculous that if you're not positive for band 41 and you're positive for band 23 and it's considered negative, and yet band 41 is 350 different organisms have band 41. So we really believe that the CDC has to change their criteria for what is positive on the Western blot. IGeneX actually changed its criteria. Why is IGeneX able to do this? Because IGeneX is a private lab that does not sell its lab kit out to anybody else. So if you get blood drawn at our office, it's sent to their lab. If they were not a private lab, if they were a public lab that sent it to hospitals, they would have to adhere to the CDC criteria and could only report those 5 bands or 3 bands. That is the difference. So my feeling is if you're, if you have symptoms that could be suggestive of all the stuff that we talked about, then that could be what's going on. I think I will maybe take 2 other questions. I just want to tell you that this is why this practice works. You saw it. I mean, I don't know some of the stuff that these guys said. I'm like going, really? Wow. It's together that we act as your blanket, your fabric. This is why I believe integrative medicine works, because together we know a lot more than I do individually. And these are some pretty brilliant colleagues that I have the privilege to work with. And so I would say I will take 2 more questions and that's it.
Are all of these people going back and forth between Del Mar and
That, it's Bennington, because Burlington's a lot further. Corey goes, I go, Chris goes. And then we have a massage therapist there who is also terrific. We are looking to see about a nurse practitioner as well, but that's it.
And the rest of them are in Delmar?
In Delmar, yep.
I'm a medical technologist. Does it concern you at all about IGeneX being just an independent company able to post these bans basically that nobody else does with no regulatory commission looking over what they're doing?
Yeah.
Does it concern you at all about that?
I mean, anything concerns me, and I will tell you that an independent review was done, so I'm going to actually refute what you just said. An independent review was done for IGeneX. It was blinded. It was sent to the government. So independent, didn't know it was IGeneX. And of all the lab testing, it was the most sensitive for Lyme testing. You know, I think every test has some potential problem with it. Every test has a potential for self-serving. What we've seen is that there are people that we think have Lyme disease, we get tested, and they're still negative on IGeneX. So not everyone comes up positive. You know, I mean, I'd say it's an independent lab. You know, independent people do good things. Independent companies do good things. There are independent companies that do bad things. So I think, you know, again, it's one other tool. It's kind of like the CPK I spoke about, the troponin I spoke about. It's like the EKG. It's just one criteria. Thank you so much, everyone. We really appreciate your time coming here and your attention.